title of this presentation is Inclusion Matters. Inclusion Matters is a new programme commissioned by Cornwall Council involving Cornwall Rural Community Charity. There's a whole row of, there we go, of CRCC colleagues over there. It includes Disability Cornwall, Age UK, Inclusion Cornwall and Digital Cornwall. And aren't you impressed? I remembered all of those names, thank you. And I'm not even looking at my notes. But it's bigger than the sum of its parts. The whole point of that programme is to look at how we as a group of organisations can connect, can support, can provide an easy, simple access into the sector and all the community has to offer. And in the housing workshop that I was in, that was really key. Actually, how do you create place-based solutions in a county as varied and fragmented as Cornwall? So I'm going to first of all start by introducing you to a few people. So this is William. So these are real people, not specifically involved in Smartline, but people that we've come into contact with over the last couple of months. There's colleagues here that will know some of these individuals. They've all given permission. Don't fret, we're all GDPR compliant. But they are people who live in Cornwall who have come for some kind of support. And it's important that we tell their story. And then what does this look like in the context of them? So this is William. We first met William after he'd had a fall in hospital. His wife, Jean, is in her early 60s. He's in his early 70s. When we came into contact with them, the key thing that was important to them was their health. They just had a fall. They live in a rural area. William doesn't drive anymore. Jean has never been able to drive. They are completely rurally isolated. And actually, it became ever more apparent to them as William's health is deteriorating just how difficult that is going to be and just how challenging it's going to be. So one of the key things that they were interested in is actually how can they do more for themselves? How could they become more healthy? What kind of information, what kind of guidance could we give them? So they live just outside of Bude. Well, in Bude, we have a diabetes prevention facilitator. And both William and Jean were prescribed by their GP into that scheme, and we were able to support them over the course of a couple of months. And what's interesting is William had a smartphone, but actually never used it at all to be able to find information about how to become healthy. He only used it to text and contact his daughter. That was the only thing that he used it for. And of the 2,500 people we've supported through the diabetes prevention, I would say only about 20% of those were using any kind of digital connection to be able to give them the information that they needed to have a healthy lifestyle. So on to who's next. It is, you can see I haven't run through these, haven't you? I'm going to introduce you to Tony. So Tony came through on an email through our helpline. So he's a father of a young family. There are 5 of them. It was a Friday afternoon, typical scenario. They've been rehoused as an emergency 15 miles away from the nearest food bank. So although they had food bank vouchers, they had absolutely no way of getting there to be able to pick up food. And they also didn't have electricity either. Or not enough on their key to be able to afford electricity. Benefits had been delayed, and he was struggling to be able to feed his family over the weekend. This is not unusual. This happens quite a bit. That's why we have so many food banks in Cornwall. The difficulty then is, so how do you get food to somebody who lives 15 miles away from the nearest town in a food bank that is unable to be able to provide outreach? So that was a whole series of conversations and phone calls with different voluntary agencies and individuals within a community, to the point at which the local landlord of a pub went out, collected Tony, took him to a food bank so he could choose his own food, got money for the electricity meter and came back. And by the next week it was sorted. But that kind of community cohesion, who is it within villages then, and communities in Cornwall that will step up and be able to provide that connective network? So next up we have Claire. Now, Claire I know very well because she works with me. So Claire is 55 years old. She was a primary school teacher for 20 years, and she came to us after a long period of being out of work because of mental anxiety and physical disability. So she hadn't worked for ages. She wanted to get back into the workforce, but actually had no idea and no confidence in how she was going to do that. So we found funding through Cornwall College. She came to us for a number of years as a volunteer until she felt confident enough to be able to become an apprentice, and now she's running our therapeutic gardening service. Now, we are blessed in Cornwall to have lots and lots of people like Claire, lots and lots of people who either move down here or retire early, but actually want to get back into the workforce. One of the programmes that we're working on with the Centre and Disability Cornwall is called the Inclusivity Project, looking at how we can support employers to be able to recruit, retrain, engage people in their 50s and 60s to live and work longer in Cornwall. And Claire is a joy. When you go around to the organisation, there's not a bit of the organisation that she hasn't volunteered in. And every single person will tell you, we just want more Claires. And finally, we have Barbara. So Barbara's 81 years old, and she comes to our Falmouth Day Centre. She suffers a little bit from confusion, but by and large, she lives on her own, quite independently, but she is very physically disabled and doesn't really mobilise terribly well. So she wandered in to one of our IT and biscuit sessions in Falmouth, run by Digital Inclusion, and just stumbled across it, didn't actually have any digital connection at all, wasn't using it, wasn't really interested, just fancied a bit of a nose, and there's cake that's delivered in the IT and biscuits. And I think that was the draw for Barbara to go in there. But once she got in there, the volunteer that runs that, Alan, started to talk to her about what digital can do and how it might help her connect. And one of the things that Barbara loves is audiobooks. Because she's quite disabled and because her eyesight is going, audiobooks are a real thing for her. So we gave her an Echo Spot and we asked her to test it for us. And she's still one of our testers now. She's had that thing for about 6 months. She's not going to let it go anytime soon. There's no research involved now. She's just holding on to it for grim life. But she starts to use it for recipes. She uses it for talking to her about recipes. She still uses it for audiobooks. She uses it for medication prompts. And she's beginning to feed back and support others that are also using it for similar activities. So what's the point of all of those stories? And what can we learn? Well, for us, everybody's got a story. Everybody's got a starting point. Everybody's got a conversation that they can have. And we've talked a little bit about guided conversations throughout the day, and I'll talk a little bit more about it. People don't neatly fit into a pathway or a project or a programme. We are complex human beings, as Ian said earlier on. We tend to go on our own path. And all of those individuals, at some point, what they've got in common is that they've fallen through the system in some way. They've fallen through a gap of all of the provision that we have in Cornwall. Every community is different. Every community has a different character. It has a different value base. It has different people in it. It has a different offer. It creates different challenges. So when we're looking at solutions across Cornwall, it's really difficult because one size definitely doesn't fit all. One of the things that we often talk about as an organisation, as a voluntary sector, is that we find things that are commissioned that are often a solution, looking for the problem. So we often go into organisations, into communities, into people's lives with a really clear idea about what would help. And then we're a bit surprised when it doesn't. And one of the things, one of the rationales for that is we don't listen to the story. We don't understand the character, and you don't understand the challenges that that individual has. One of the key things, though, that I think we know as an organisation, and collectively we all know about the Smartline project, is that if you are not digitally connected, you're information poor. So regardless of whether you see digital as a tool or as an enabler if you're not digitally connected, it is really difficult to continue to live your lives. We come across people endlessly that can't get their own money out because they don't do online banking, that can't communicate with people, that don't know what they're entitled to, that aren't able to fill in their forms because they're all online. All of those things require support around it. And the last thing, and I'll come back onto this, transport and access, absolute defining factor for Cornwall. The number of people who are also transport poor that cannot get access to the facilities and activities around our county simply because there is nothing there available for them. So I've got my 5-minute warning from Zoe. So I am quickly going to say, how do we make it a reality? Well, we asked our staff and our managers and our volunteers what makes a difference if we're going to have a conversation with you about your well-being. How do you feel about that? Quite a lot of people felt like this. Quite a lot of our managers felt nervous about having a conversation about somebody's well-being because, oh my God, what if they actually tell you? You might need to do something about it. And quite a lot of our staff and volunteer teams felt, well, I don't want to tell you everything to do about me because I've no idea what you're going to do with that information. So as an organisation, we've spent enormous amounts of time encouraging, engaging, motivating our staff to be confident about having those conversations. And I think part of the Smartline, the guided conversation, is also about the importance of being confident about having conversations with people. So I won't go through all of this because I'll get the thing. I'm waiting for the thing, Zoe. I've gone 5 minutes now, like 2 minutes to, and then it's like that. So I won't go through all of this, but these are some of the things that I think Smartline has pulled out about being important, but that we know also as a community, about that flexible transport, about being able to connect people, about the importance of place, about the importance of having flexible working patterns and looking at volunteering, not just in its own right, but as a step change through to work. One of the key bits of information that I want to give to you is the development of the Cornwall link. So as part of the Inclusion Matters programme, we have something called the Cornwall link. You can Google it. And that is a portal, an online portal, where any bit of information of something that's happening in your community can be uploaded. Now everybody's got access to it. There's a helpline that runs alongside it as a telephone and face-to-face interview. But all of that information is about connecting people, about connecting activities, about connecting community together. So I am going to start. But before I do, I'm going to come on to a video, just a few minutes. And I'm going to apologise first to many, many people who are sitting around here who've seen this video already. I wasn't going to use this video at all because it's quite a few years old now. But because of the guided conversation, and this is effectively where it came to, it's really important that we keep coming back to the story of the individual. What makes a difference to you? To me, and how do we then focus on developing some of those solutions around it?